is Heather McCrell, and I'm the Program Director for the Physical Therapist Assistant Program here at Calhoun Community College. I'm so glad you're joining us for this information session, and I hope that you learn a lot about our program and our application process through this time. We also have other faculty that are a part of our program. Tiffany Bain is the Academic Coordinator for Clinical Education. She's full-time. We have 3 adjunct faculty and lab assistants, Mary Thompson, Mandy Irway, and Chastity Lynch. The goal and my objectives for this session are to talk about the role of the PTA, provide an overview of our program, discuss the requirements to become a PTA, and specifically talk about our application process, the requirements for our application, and the selection process that we go through here at Calhoun in our PTA program. Now, if we were meeting in person, I would take time, we would have time to ask questions as a group. Obviously, we can't do that as a group, but I want to provide some resources that will hopefully answer any questions that you may have that aren't answered through this information session. And if you do check out these resources and can't find the answer to your question, please don't hesitate to contact us. And so if we visit this first link, you'll see that it takes us to our Calhoun Physical Therapist Assistant webpage. And so you would go to calhoun.edu and find our Physical Therapist Assistant page. And on this page, you can access our application packet. Now, if you have looked at the application in previous years, you want to make sure that you are using the 2021 application if you're applying in the spring of 2021. We also have a frequently asked questions link over here under resources, and there is a list of questions that have come up because students interested in our program have asked, and so we've tried to be thorough in answering the questions that have come up in the past. And so I would encourage you to visit this page if you think of a question or you're not sure about. So for example, do I have to retake the ACT? You do not have to take the ACT at all, in fact. We accept the reading score from the ACT or from the AccuPlacer. And all Alabama community colleges offer the AccuPlacer for free. And so if you were to want to take that at Calhoun, you could go to this website and set up an appointment. Also, if you wanted to prepare for the test through this FAQ, the frequently asked questions link, you could click here and it would give you some information about preparing for the test. So again, do I have to retake the ACT? No, you do not. You don't need to take the ACT. You can choose to either take the ACT or the AccuPlacer, and we need the reading score, and it would need to be within the past 3 years. And so again, these links, the application packet, the frequently asked questions, but all of this can be found on our PTA webpage through calhoun.edu. If you haven't visited our campus, this is the Health Science Building. Housed within the Health Science Building are several different programs. And if you go to calhoun.edu again, go to the Health Sciences homepage, you can see those programs listed here. So it's nice to know that we offer a variety of programs within the Health Science Building. All of the students, the health science and allied health and nursing students, we wear scrubs, and each program has their own color scrubs. So it really has a feel of working with other healthcare professionals, interprofessional care, and you get the feel that you're at a hospital or a clinic, and it's nice to collaborate with other programs. And so, as you saw on that page, we have nursing, medical laboratory technology, dental assisting, dental hygiene, which is coming soon, surgical technology, EMT and paramedic programs, and of course our PTA program. Now, looking specifically at a PTA is an educated, skilled healthcare worker who, under the direction and supervision of the physical therapist, provides treatment to individuals of all ages with medical problems or other health-related conditions that limit their abilities to move and perform functional activities in their daily lives. The differences between a PT and a PTA: the physical therapist is the person that sees the patient first. The patient comes in or is referred or is in the hospital. The PT will do the evaluation and figure out the physical therapy diagnosis and the problem list and just develop a plan of care and the interventions that should be provided to meet the goals that the PT sets. The PTA can then implement that plan of care, implement the interventions to help work towards those goals set by the PT. And then the physical therapist will ultimately discharge the patient once those goals have been met and the patient meets their optimal functional abilities. If you would like more information about physical therapy, our national organization is the American Physical Therapy Association, or the APTA, and their website provides a lot of information, a lot of resources about physical therapy. Come over here to the menu. You can see that there's so much information that can be looked up through here, and a link for students and information for the student as well. And so I encourage you, if you want to learn more about physical therapy, to visit apta.org. The requirements to become a PTA: you must graduate from an accredited PTA program. Our program here at Calhoun is accredited through the Physical Therapy Accrediting Body, which is CAPTE. Upon graduation, you would earn an Associate of Applied Science degree. And then after graduation, students are not automatically a PTA. They need to successfully complete the National Licensure Examination. And this is an exam that is offered through the FSBPT, or the Federation of State Boards of Physical Therapy, and it's offered 4 times a year. And in order to be licensed in whatever state somebody wants to be licensed in, they would go through a background check. And licensure shall be refused to any applicant who is of other than good moral character. So if you have something in your background that you're concerned about, you would definitely want to look into that. You could contact the Board of Physical Therapy for the state that you want to be licensed in. The number for the Alabama Board of Physical Therapy is here. Our Board of Physical Therapy webpage. Offers a lot of information about our board here in Alabama, becoming licensed, our Practice Act, our administrative code, and so there's a good deal of information here as well. So our mission and vision at our program here at Calhoun, we take really very seriously. We've developed this mission and vision, and it's how we view our teaching methods and our goals for our students and what we want from them. And so this is something that we implement every day, and every time we're planning our lesson and our activities and our clinicals is to graduate knowledgeable, skilled, competent, professional, and service-oriented entry-level physical therapist assistants who, under the direction and supervision of the physical therapist, provide quality physical therapy care that meets the needs of employers and the public. This is our goal. This is our mission in our program, and we take that really seriously. I hope that you take some time to check out our webpage at Calhoun, the PTA page, and read more about our vision and our goals and our outcome measures so you can learn more about our program. Here at Calhoun, we accept 24 students each year into our PTA program. Those students that are accepted begin each fall. Our program is 5 consecutive semesters, and those PTA courses need to be taken in sequence over the 5 semesters. So the courses that are taken in the first semester are built upon in the next semesters. Now let's take a look at the curriculum for our program. I'm going to go through each of the semesters and give you a quick overview of what is involved in each of the classes so you can understand how our program is laid out. In the first semester, you can take medical terminology if you've not already done so, and I'll talk about that a little bit more in a minute. PTA 250 Therapeutic Procedures 1 is a basic skills course. You learn to position patients, do passive range of motion, fit them for a wheelchair, teach them to use assistive devices like a cane or a walker, and also learn about wound care. Physical Therapy Issues and Trends is an introductory class where you learn about the profession, the different settings that you can work in, because we treat patients that are of all ages, from babies to elderly. There's many different environments that you can work in: outpatient or home health or the hospital or the school system. And so we look at each of those. We talk about our Practice Act and the laws involved with physical therapy, and the APTA, our national organization. PTA 220 and 221 are an anatomy lecture and lab, and this is a fundamental class and fundamental information for physical therapy, learning all about the musculoskeletal system and how it works. If we look at our application packet, that I showed you before. So again, looking at the 2021 application, and if you go to page 8, it looks at the general education courses, which I'll go over in a minute. But there's also a space here for medical terminology. Medical terminology can be taken prior to starting the program. And so you saw it listed there in the first semester. If you haven't taken it already, then you would take it in that first semester. But if you've taken medical terminology at Calhoun or another college and it transfers to your Calhoun transcript, you can actually get points for that on your application. So I wanted to point that out. So you see it listed here in the first semester. You would take that in the first semester if you haven't already taken it and gotten credit for it on the Calhoun transcript. Second semester, PTA communication skills looks at documentation in the medical record, and we teach you how to do that. Physical therapy disabilities 1 looks at pathologies of the systems of the body outside of the neuromuscular and musculoskeletal system. So we're looking at the cardiovascular system, respiratory system, integumentary system, GI, endocrine system. So talking about different conditions that affect different parts of the body and how that might present itself in physical therapy. Therapeutic Procedures 2 is assessments course, learning how to assess somebody's strength, their range of motion, taking a look at their gait and how they walk and their posture and their balance. And physical agents and therapeutic modalities, we teach you how to use and the theory behind modalities such as cold packs and hot packs, ultrasound, electrical stimulation, traction, and then we do some soft tissue mobilization and massage in that class as well. In the third semester, we look at orthopedic conditions such as total knee replacement, total hip replacement, ankle sprain, knee problems, ACL repair, shoulder injuries, and how to treat them. There's also a neuroscience course, which is you learn about neuroanatomy. So this is over the summer. And then the fourth semester in the fall, that would be your second fall of courses. We talk about neurological conditions and how to treat those, such as a stroke, a traumatic brain injury, spinal cord injury, multiple sclerosis, Parkinson's, and so you learn about those different conditions and then how you would provide interventions for them. In the 4th semester, you would go on your first clinical rotation. This is a 6-week clinical rotation where you go into a facility, a hospital, or an outpatient clinic, and you would be there full-time during the week. In our program, our students go on 3 6-week clinicals, so this would be the first of the 3. In the 5th and final semester, we have a capstone course, a physical therapist assistant seminar, and in this course, we prepare you for graduation and licensure and getting a job. So we have somebody come in and talk about resume writing, interview skills. We have a company come in and do a board prep course. We have the Alabama Board of Physical Therapy come in and get you ready for licensure. So our goal is that you are successful when you leave our program. And then you also take and go on your 2nd and 3rd clinical rotations, each being 6 weeks long, 2 different facilities. Our courses, our lecture courses, meet Monday through Thursday on campus. We are on the Decatur campus. Classes are typically between 8 and 3, but many students stay after class to have study groups and use our equipment, and so they may stay into the early evening. Courses with lab components require hands-on participation and lab attire that allows practice on, palpation of, and observation of body segments, such as the shoulder or the low back or the scapula or the hip. And so wearing shorts or a tank top and when it's time to study those different parts of the body. As I mentioned, our curriculum includes 3 clinical rotations, so 18 weeks total. These are full-time experiences in a physical therapy department, and you are learning under a clinical instructor. That clinical instructor may be a PT or a PTA. We send our students to facilities based on their educational needs. So we're not looking to send students to the facility that's closest to them. We want them to have an optimal educational experience. And so our clinical coordinator, Tiffany Bain, spends a lot of time making sure that she's matching students where they the fit is greatest for them and their educational needs. We have facilities in the Huntsville area, northern Alabama area, southern Tennessee, and eastern Mississippi. And each student goes into 3 different settings: acute, outpatient, and inpatient rehab. In order to go to the clinic, there's some screening processes that need to be done. This is not something that is done now. It would be done as it gets closer to the time of going into the clinic: drug and alcohol screening, background check, physical, immunizations, TB screening, and a current healthcare provider basic life support certification. Again, this is nothing that should be done now. The eligibility criteria is a list of skills and capabilities required of the PTA. This is in our application, and it talks about the different abilities that are required to be a PTA. If you need special assistance or services in order to meet those capabilities, we ask that you contact our Student Disability Services, and the number there is provided so we can make sure that we help to get what you need in order to meet those capabilities. General education coursework for our program. These courses are not prerequisites to enrollment or to apply for our program, but they must be completed in order to graduate. However, if you look at our application, you will see that these courses, if you have taken them and the higher the grade, improve your chances of being accepted into the program. So I'm going to return to our application. Again, I'm looking at the 2021 PTA application, and these Gen Ed courses are not prerequisites, but if you have taken them, you get points for that. Human Anatomy and Physiology 1 and 2 need to be taken within the last 10 years. And the reason for that is the knowledge that you learn in those classes directly helps you with this program because of the need for knowledge and understanding of the human body and how it works. Any general education course not completed prior to admission must be scheduled individually by the student and successfully completed to graduate, and you must receive a grade of C or higher for it to count towards graduation. These gen ed courses are A&P, Anatomy and Physiology 1 and 2, English Composition 1, General Psychology, Human Growth and Development. If you are brand new to college, then you will be asked to enroll in Orientation 110. If you've already taken college classes, you would not need to take that class. Mathematics 100. The application also shows what other math courses that are accepted. And so any of these would be accepted. And so you would indicate on your application by highlighting the course that you want to get credit for and then the grade. 3 credits of humanities or fine arts, and then a speech elective. The cost of our program for in-state is about $13,500, and for out-of-state is about $22,500. These two numbers are based on 69 hours of coursework, and so every general education course that you've already taken decreases this cost. And so if you have taken all of your gen ed courses, then this number goes down significantly. The books and additional cost includes the books for the 5 semesters, the background check, drug screen, CPR certification, the physical, TB test, vaccinations, Hep B series. It includes malpractice insurance. This is a cost that you would see on your Calhoun bill. You wouldn't have to seek that out on your own. And then, as I mentioned before, our program has a uniform, and so part of that is purchasing the scrubs and then a polo that would be appropriate for an outpatient setting. And so that's something that we specifically would tell you which ones that you would need to purchase. To be successful in the program, you need good study skills. The program is challenging. Students say that they make a lot of sacrifices in terms of time that they spend studying away from their family, away from their friends, but they say that it is so worth it in the end. So you need good study skills, be able to have good time management. Professionalism is something that is expected of our students in the classroom and in the clinic, showing up on time, being attentive, being dressed in the uniform, being respectful to faculty and classmates, because we expect that what we see in the classroom is what is seen in the clinic. And so we expect professionalism at all times in class. Work no more than 20 hours per week. We understand that finances can be really tough. We have a financial aid office that if that's something that you need, you can look into. We encourage you to look into. Students that work more than 20 hours struggle. It's hard to work 40 hours a week and then have time to study and come to class. So it's been done, but we encourage you to work less than 20 hours per week. And have reliable transportation for clinical courses. When we send you into the clinic for the 6-week time periods, you need to be able to show up when they ask you to show up to treat patients. So that reliable transportation is important. I'm going to now turn it over to my colleague Tiffany Bain, who's the clinical coordinator, and I appreciate your time, and I hope that this helps to answer some of the questions that you have. Thank you.
This is the second part of the information session. We're actually going to be covering the application process itself, what's required for admission into the program. So just know that meeting these minimum requirements does not guarantee a place in the program. So first, you need to have unconditional admission to the college. So if you've not applied to the college at this point, I would recommend going ahead and starting that process. It does take a little bit of time to get everything through. So once you get admitted to the college, then you will send your transcripts from all other institutions, if you've taken courses at institutions, to the college, because we have to have unofficial transcripts for all courses that you've taken. A minimum reading score on the ACT or AccuPlacer test taken within the last 3 years. We're just looking at the reading assessment portion. 5 hours of documented physical therapy observation, and then the application is due by April the 14th at 3 p.m. So like we talked about, if you've not applied to the college, I would recommend going ahead and applying to the college. It takes at least 6 to 8 weeks before the deadline, just to make sure you give yourself plenty of time to get everything done. Once you're admitted to the college, have transcripts from all other institutions sent to Calhoun. That way, Calhoun Admissions and Records can look over the transcripts to determine which courses transfer, which courses do not. The faculty and staff of the PTA program cannot look at transcripts to determine which courses transfer. And then go to the program webpage. There's a frequently asked questions section. There's a plethora of information there. So if you have questions, I suggest go there first. You'll probably more than likely find the answer at that frequently asked questions. Acceptance is very competitive, so make sure your application is complete. If you submit an incomplete application, then that's guaranteed not getting into the program, because we only look at completed applications. The program works off a 100-point system. 85 of those points come from academic points. 15 points come from professionalism points. So this is kind of how the points are broken down. Of those 85 academic points, up to 5 come from that reading assessment score from your AccuPlacer or the ACT. And then the other 80 points come from completion of general education courses. Then the 15 professionalism points, up to 5 for the information session, which if you're watching this video, then you are on the right track to getting up to those 5 points. And then 10 points for your 5 hours of observation. So we look at the ACT reading or AccuPlacer reading score. It is required of all applicants, and it must have been taken within the last 3 years. So if you have a bachelor's, a master's, a doctorate, whatever level of education you have, and you have not taken the ACT or an AccuPlacer reading assessment within the last 3 years, you must take the test. You must take the assessment. We get asked every time, well, I have my bachelor's, it was 10 years ago when I took the ACT. Do I have to do this? Yes, you do. It must be with all applicants within the last 3 years. This gets up to 5 points on your application. Now, the AccuPlacer reading test is you can take at any community college. They're doing it in an online format, and it is free the first time you take that test. So if you're wondering if you should take ACT or AccuPlacer, one's free, one's not. So I typically like to go with the more cost-effective option. If you need to take the AccuPlacer, you will email the email you see here, advising@calhoun.edu. Make sure you include your A number and then what part of the test you need, and they will set up a time for you to take that test in a remote format if they're not doing it on campus. This is the breakdown for the scoring system. So if you get below an 18 on the ACT reading or below a 250 on the reading portion of the AccuPlacer, you would be ineligible to apply and be admitted to the PTA program. And then you can see the point system, how they lay out. Now, if you are in that 18 to 19 range for the ACT, the 250 to 256 range for the AccuPlacer, you would not get points for those. If you choose not to retake it and you just want to submit those scores, make sure that is in the application. Make sure that you submit that score in your application packet, And don't just think to yourself, well, I'm not going to get any points, so I'm not going to submit it, because it looks like an incomplete application if you do not submit those scores. So if you do choose to not get any points, make sure that you still submit the score page in your application packet. Now, the rest of the points, the 80 points for your general education coursework that's completed, so that, like we've already discussed, the classes either have had to have been taken at Calhoun or have been accepted as in transfer by Calhoun and must appear on a Calhoun transcript. Classes must have been completed with a grade of C or above to be eligible for the program. This is the worksheet that you would do. So you're going to fill in this worksheet yourself. You'll circle each grade that was earned for the general education courses completed. You're going to actually have an idea of where you stand in those 80 points after you get the worksheet done. If you're taking spring courses, so if you're taking courses in spring of 21, then you're just going to notate that on this form so that the admissions committee knows to be looking for those spring grades to come in. So if you're taking Bio 202, so which is Human Anatomy and Physiology 2, spring of 21, just right out beside it, just say anything like taking spring 21, so that the admissions committee knows to be on the lookout for that. So you will, excuse me, if you have multiple options, like in math, if you have Math 100, Math 110, make sure you note on the worksheet in that little blank area which math you are you're claiming. So if you're claiming Math 112, make sure you put that on that little blank line so that it just makes it easier for the admissions committee to tally the points. So if you're taking spring courses of 2021, you can turn in those grades by May 18th at 3 p.m. Make sure that if you are taking spring courses, you put this due date in your phone so you get an alert. However, you keep track of your appointments and your to-do list. That way you do not forget to turn in your spring grades. We have had applicants in the past that have been set up really good to be admitted into the program. If they would have turned in their spring grades, they did not turn in spring grades, therefore they did not get accepted into the program. So make sure you do not forget to turn in your spring grades, whatever you have to do to remind yourself. All right, so you either have had to take courses at Calhoun or, like we've said, have to be accepted as transfer by the Office of Admissions and Records. Do not submit a transcript from another institution in your PTA packet. Do not submit a transcript from another institution in your PTA packet. It's very important. You must submit an unofficial Calhoun transcript in your PTA packet. So as you're going through your courses, you're going to highlight the courses that you're claiming that match with that worksheet that we just talked about. So what it's going to look like, this is an unofficial transcript. You would just go into your, once you have your A number, you go into your My Calhoun setting, and then you can pull up this transcript. So it does not have to be an official transcript. It's an unofficial transcript. So you're going to highlight the courses. If it has a T in front of it, that means it's a transfer course. And so you had a transfer and then whatever the grade was that transferred. So T means transfer. That way, if you're looking for courses that you've taken in other institutions, if they've transferred, you'll be looking for those T's. And then if you've taken the courses at Calhoun, there'll be no T in front of it. You just have the grade there. And so you're going to go in and highlight the courses that you're claiming. Then you can get up, so as far as professionalism points, you can get up to 5 points for watching these information session videos and completing the assessment that's associated with watching the videos. Then for observation hours, you can get up to 10 points for completing 5 hours of observation. The application takes you through the process. The 5 hours can be from any setting that you're able to get in. We do supply the form that you need to complete those on. The form the form has to be the form that's in the packet. You cannot use a form from another institution. If you decide to get 2 hours from one place, 3 hours from another place, then you need to have a different form for each facility. The hours must be signed by a licensed personnel, so you're going to put in the therapist's name and provide their license number, whatever their license number is. We do accept personal experience as observation hours. So you can be an employee, but we're still only going to look at 5 hours. So even if you have 1,000 hours, it's not going to benefit you anymore versus someone that has 5 hours. It's all the same. You can use it as a patient. So if you've been a patient in a therapy clinic, you can use the time there. Just make sure that it's verifiable. So if you had therapy 15 years ago, you need to make sure that they remember who you are, which is probably after 15 years, might not be very likely. So just kind of use some common sense with that. It needs to be verifiable. So if the admissions committee reaches out to the facility and asks if so-and-so has done observation hours there, they can say, yep, I remember that. And plus it has to be signed and verified by that personnel anyway. You're going to read and sign your statements of understanding, which is page 12 through 17. Turn in all of those pages in the application packet. So the application packet, the initial application packet minus spring grades is due April the 13th by 3 p.m. So you want to make sure that you put those in the mail to give yourself enough time to get those in by the deadline. If your thought is that you're going to hand deliver those, you may want to call the health science department and see if the building is open for submission of applications. It may just be that they're only available through mail-in. You just have to call and ask about that if you want to hand them in. All documentation needs to be in one envelope. Don't paperclip, don't staple, don't put little sticky tabs. Just put them all loose sheets in one envelope. That way the admissions committee can easily just pull and separate the forms as they need to. Do not fax or email in your application packet. It would not be considered. Make copies of your application. Applications will not be released once they're turned in. So if for some reason you do not get in this application time and you want to apply next year, you have copies of your application that you could resubmit some of those forms. That way you're not having to go out and get more hours. You already have that documentation. Like I've mentioned already, incomplete applications will not be considered. Make sure that you go through that checklist that's in your application packet and verify that you've done all the steps. If you verify that you've done the steps, then your application should be complete. Now, for spring grades of 21, you turn those in by May the 18th at 3 p.m. Now, we will accept spring grades transcripts from another institution. There's just not enough turnaround time to get those submitted to Calhoun and then assessed before the deadline for those spring grades. So if you are taking courses spring semester, you can submit an unofficial transcript from another institution. That is the only exception in regards to transcripts. All other transcripts have to be on that unofficial Calhoun transcript. Spring grades, you can submit a transcript from another institution. The due date is May the 18th at 3 p.m. So once the applications are turned in, the transcripts are evaluated. The application criteria is evaluated by the admissions committee. Points are verified, they're signed, and they're calculated. And then the top 24 are ranked. Then there's a wait list. And so letters for all applicants will be mailed out on the same day. It's typically mid-June when those letters get mailed. There will be 24 acceptance letters. There will be the waitlist letters, and then there will be regret letters that are sent out on that same day. If you move after you submit your application, make sure you update your new address with the program so that if you are selected, that your letter gets sent to you and you don't miss out on the opportunity because you didn't update your address. So again, just to remind you, don't use staples, page protectors, paper clips. Just put free loose paper in your application packet. Make sure your writing is legible, that the admissions committee can read what you have written down. Don't spray it with perfume. Don't have coffee stains on it. This is a professional document, and so you want to present yourself professionally. All right, so if you do have questions, like I mentioned, go to that frequently asked questions section on the program webpage. There's so much information there. If we get asked a question, then it gets updated on that frequently asked question. So I bet if you have a question, it's been asked before, and it can be answered at that frequently asked questions. If your answer is not there, then feel free to reach out to someone at the program, and we'll be happy to answer your questions. Thank you so much.